I'm Dr. Andrew Kersten, and I'm an orthopedic surgeon that specializes in shoulder, knee, and sports medicine. And I see patients in our South Asheville locations and our Hendersonville location. For my orthopedic specialty, I specialize in sports medicine and then shoulder and knee surgery mostly. So that involves a lot of arthroscopic surgery, such as labral repairs for dislocations and ACL surgery and rotator cuff surgery and things that we can do with a small camera. Also deals with a lot of athletic injuries, so taking care of tendon ruptures and different overuse injuries we see in sports. And then I also specialize in shoulder reconstruction, replacing shoulders and revisions of those, and also do a lot of robotic total knee replacement. So what got me into medicine initially was I basically had a lot of good mentors early on. I was exposed to a lot of friends through church and through our family that were physicians and took to liking it. And I think I decided probably even in grade school that I wanted to be a doctor, but then it took me a little while to determine that I liked orthopedics. I was involved a lot with sports, had some exposure early on to orthopedics, had exposure to it through the sports medicine side of things, being an athlete, and just really liked the idea of being able to take a problem, fix it, solve it, get somebody back on doing what they love from a sports standpoint. My favorite part about being in Emerge is really, I think we've got a great group of doctors across all specialties, and I feel comfortable having them, take care of my family and friends, and everybody has their specialties and things they can do. I like that we have a wide service area, basically, so if I've got somebody that lives up north of town, they could see those guys that work there, people that work in different areas. I like the independence of the practice, and that we're not we're like-minded folks that are wanting to take care of patients and do what's best for the patient, and not necessarily at the whim of other pressures such as the hospital or insurance. So yeah, patients may ask, why would they want to come see us or go to the hospital or go to their primary care doc? I think the advantage, even from time of injury, as we operate walk-in clinics and urgent cares, all of our facilities, and if a patient comes into one of those locations, they're going to be seen by somebody that basically specializes in orthopedics. So you're going to get a little more specialized care for orthopedics in general at our locations, which isn't going to be allow them to refer somebody to a higher level, specialist such as myself or one of my partners if needed. And then that allows us to, again, with our independence, make a determination on what's going to be best for the patient in terms of location for surgery. We all work out of different hospitals in the area, and there's times where that may be the best place for a patient, but often we can take it to one of the local surgery centers. And the surgery centers are a great option because they're typically lower cost. They're outpatient. Most patients can go home in the same day, and we can do a lot of these procedures safely in one of those settings, which then also translates into a significant cost savings to a patient.